Good afternoon. This is Dr. John Bennett broadcasting from sunny Miami. Today we have the fortune of having Carrie Stern, a cosmetic surgeon from New York City, who was the inventor of the MirrorMe3D platform, and she's going to talk about that amongst other topics. So welcome, Carrie. It's all yours.
Thanks so much for having me. Good afternoon, everyone. I am Carrie Stern, and I am going to be talking a little bit about the use of 3D printing in cosmetic surgery. So these are my disclosures. I was founder of a company called MirrorMe3D, which I will highlight a little bit about why the company was started and where I think the future of this technology has a role in plastic surgery. So I'm going to first start with a background, talk a little bit about the use of 3D photography in plastic surgery, where currently 3D printing has a place in plastic surgery, and then how 3D printing will change cosmetic surgery in various aspects as I have listed there. So first, what you can see is technology is used in plastic surgery in various different areas, starting with consultation. There's a role in intraoperative planning, marketing and branding, and throughout the talk, I'm going to refer back to this diagram and highlight how we believe 3D printing can affect all these different areas. So first, to start with, what technology is currently used in plastic surgery? And so when you look at the 3D imaging technology currently in plastic surgery, there are a whole different types of 3D camera systems or captures that I'll talk about. There is the use of simulation in plastic surgery, which is looking at patients, what they look like prior to surgery and what they'll look like following surgery. The concept of virtual reality, and of course, we'll talk about 3D printing. And what people ask all the time is this technology valuable in aesthetic surgery? And obviously, I believe the answer is yes, and it affects, it has an impact both in terms of marketing and branding for surgeons, but there's definitely a role for surgical planning, and the use of 3D prints as a clinical tool is a new concept that this company was founded on, and I will be talking about and highlighting as well. So starting with surgical simulation and 3D capture systems, many plastic surgeons these days, or increasing number of plastic surgeons, are using 3D cameras or capture systems in their office. These camera systems are either handheld devices, larger booths that patients have to go into, or even scanner technologies that are attached to iPads that surgeons use in their office. And the reason why this is becoming more routine is that the cost of these capture systems have come down, and there's an ease of capture, ease of use. And so many surgeons are now using these camera systems in their office. And the benefit of this is it gives doctors the ability to manipulate patient photos on the computer screen, and you can show patients what their desired or potential operative results would be if they would undergo surgery. However, this is still limited. So if you take a 3D picture of a patient and show it to them on a 2D computer screen, it's still very difficult for an average patient to visualize because you're taking a 3D photo and putting it on a 2D computer screen. And so this is less than ideal. In addition, the use of 3D photography in plastic surgery to date is mostly a marketing tool. So many surgeons will highlight on their websites or social media that they have access or have 3D cameras in their office, and they can show patients what they're going to look like if they would have a particular procedure, whether that's having their nose done or breast implants. Whatever the patient's interested in, they market it. And that's it. That's where it sort of ends. It brings patients into the office and hopefully converts them from a previous non-surgical patient to a surgical patient. So the patient comes in, they see the surgeon highlighting the fact that they have a 3D camera, and the surgeon shows them what they're going to look like, and then the patient signs up for surgery. But we believe that there's a value to 3D photography that extends far beyond just the marketing tool. And it's important in terms of analyzing patients, particularly patients who are interested in facial surgery, so facial analysis. There's a role for it in preoperative planning. In addition, there's a role for intraoperative decision-making, as well as using a lot of the 3D photography and software that comes along with it in post-operative assessment. So looking a little bit about where 3D photography started in plastic surgery, it was actually not the face, it was the breast. And the first reports of using 3D photography was in patients who had various types of breast surgery, from reconstructive breast surgery to patients who've had implants placed or breast reductions. And what was realized from this initial work was that there's a lot of information that you can gather using 3D photography and all the software, analysis software that goes along with it. So taking this one step further, looking at the face, which is much more complex compared to breast, you can really use 3D photography to analyze patients. And the benefit of this in cosmetic surgery is you can take a patient and analyze their asymmetries. Everyone's different from their right half is different than their left half. And you can talk to the patient in terms of aligning their goals and showing them what the difference is from one side of their faces to the other, or what they would look like if they had a particular procedure. But it also has tremendous value in terms of planning surgery. And so we believe that this is going to be sort of standard of care, that using 3D photography and facial analysis will become routine practice among cosmetic surgeons. But again, taking this a little bit farther, not just from the 3D picture that's on a computer screen, but looking at it, can it be used as a clinical tool and as an intraoperative reference? And so this is a typical patient who's interested in having her nose done, who presents to the office. And these are standard 2D photographs that are taken prior to surgery. And every plastic surgeon takes photographs of their patients preoperatively as their baseline photograph, different views. And this is what hers were. And obviously she's interested in having her nose done. She didn't like her tip. She didn't like the bump on her nose. And what a lot of surgeons do with these 2D photographs is simulate with them. So they don't necessarily have access to a 3D camera system, and they will show the patients what they're going to look like if she had a rhinoplasty or a nose job. And what you can see here is the profile view of the patient changes a lot, and a lot of patients see this and they're happy. And this patient who decided, yes, now that I like what my profile looks like, I'm going to now have surgery, so it's converted her to a patient. It helps patients and doctors talk to each other and align goals and help develop a plan. But this is really limited because all you can really see here is the profile view. And whenever you change something on the profile view, it changes how the patient looks at 45 degrees. It changes how the patient looks on straight on. And so, again, this is beneficial to bring patients into the office and start a conversation with the patient, but it's less than ideal in terms of really planning the surgery and less than ideal in terms of patients really understanding what they're going to look like if they had surgery. And so for surgeons, as I mentioned earlier, who have 3D camera systems, and more plastic surgeons do, they're able to do things like this, which is not just this is what you look like now and this is what you will look like, but overlay the two photographs. So you have your preoperative 3D photograph. Again, this is a patient who is interested in having her nose done all the way to the left. The middle is what her simulation would be. So if she had surgery, this is what her ideal outcome would be. And to the right, you can see the overlay, so taking her simulated version and her pre-op and superimposing them one over the other. And the little gray area that you can see is the difference between the two. And this you can see in various views and really give surgeons better insight into how things change in 3 dimensions and gives patients a better understanding of what the changes will be, not just in one view, but in various views. And so again, this is 3D simulation and 3D photography just on a computer screen, and how this will change or augment, how this could be changed going forward. And so now we're going to take that and bring that information into the operating room, and that sort of was the next step. And the use of intraoperative models is not new to plastic surgery. 3D printing has been used in reconstructive plastic surgery for a long time. Patient-specific models are printed, so patients come in, they have a CAT scan done prior to surgery, and models are made on this patient-specific data. And we use this both for patients who have congenital that need surgery for congenital problems, like if they're born with an abnormal skull shape, or for patients who have a tumor and they need an oncologic resection or a cancer operation. We can plan both their cancer operation and their reconstruction using these 3D printed models. And this, over the last several years, has become standard of care in reconstructive plastic surgery. And this is where the concept of using intraoperative models in cosmetic surgery came about. But cosmetic surgery is different than reconstructive surgery. There are many more applications for 3D printing in cosmetic surgery compared to reconstructive plastic surgery. So in reconstructive plastic surgery, you can plan your operation based on CAT scans and use it as an intraoperative reference. In cosmetic plastic surgery, what you can see on the right is that there are many other ways in which 3D printing could be beneficial in the whole plastic surgery process, not just in terms of planning the operation, but also, as mentioned, in terms of consultation, analyzing results, looking at follow-up, and of course the marketing branding aspect to it. So using the concepts of 3D printing in reconstructive plastic surgery, we decided to bring this concept of 3D printing into cosmetic plastic surgery and bring it into the operating room. So typically what you can see on the left is what is traditionally done. So surgeons bring standard 2D photographs into the operating room and use as a reference during surgery. These are the same standard 2D photographs I showed earlier, taped to the wall. This is that same patient who's interested in having her nose done, and during surgery, surgeons will look up away from the operative field and reference the patient's photographs, their baseline. But providing 3D prints to use as a supplement to or to replace traditional 2D photographs gives surgeons an actual model that they can use in the operating room. So instead of looking away from the operative field, looking at pictures taped to a wall, they can hold a model and refer to a model while they're operating. And what you can see is you can really appreciate all different angles and all different views that you would otherwise not be able to appreciate using standard 2D photographs. And it's really sort of changing the way 3D technology is used in the operating room. And so what you can see here is this is the baseline or pre-surgery model and how it's being used as an intraoperative tool, replacing the traditional 2D photographs. And it really helps surgeons guide what they're going to be doing and referring back to where the patient started. This is the beginning, where they started. And the next step would be looking at the simulated version or the ideal outcome. And so this is the 3D print of what the patient's ideal outcome would be. And the far left, you can see just at the start of surgery, and you can see the ideal outcome. They're still quite different. And as you progress from the left side to the right side of the screen, at different time points during surgery, that the actual patient is becoming more and more like the ideal outcome. And on the right, you can see that those are quite similar. So we've achieved, or the surgeon has achieved, what he intended to do. And when you start with the baseline unaugmented model, and that's your starting point, and this is your final version, you know where you're started and you know where you need to go. And it really gives surgeons a great tool to use intraoperatively. And so this is our patient. This is her before, and this is her after. Very nice results. And this is, in this case, the baseline and the simulated versions were used by the surgeon as an intraoperative reference, replacing the traditional 2D photograph. But again, there's a lot more uses. There's many more uses of 3D printing in plastic surgery. We did go through a little bit of the preoperative planning and its use as an intraoperative tool, but now we're going to talk a little bit about the consultation process and how the use of this technology is slowly changing the consultation process for plastic surgery patients. So many patients consider plastic surgery. Millions and millions of patients consider surgery at some point. And a fraction of those actually go to an office for consultation. And even fewer, so I would say about 1 in 4 patients, then decide to have surgery. And so we believe that adding 3D prints to the whole consultation process really changes this for both the patient and the doctor. For the doctor, it's a marketing and branding tool, and offering patients 3D prints can be very attractive to patients to bring them into the office. It really helps align surgeon and patient goals a little bit better than just talking to patients or visualizing things on a computer screen. And it also, as we just mentioned, optimizes surgical results for the surgeon. They know where their starting point is, they know what the ideal outcome is, and it really can improve surgical decision-making and operative techniques. And so the purpose is really to show that 3D prints, offering 3D prints, really affects various aspects or many aspects of the whole plastic surgery process. And so the question is, like, what is a typical doctor-patient consultation in plastic surgery these days? And patients come in with a whole different types of requests of what they want and who they want to look like, and doctors have to sift through all this information and come up with a plan. And so some of that is looking at a patient with a mirror and highlighting or going through what they like and what they don't like and what changes could be made. Although it's a little bit difficult to visualize because, again, you can't appreciate all angles with this method. Often patients will bring magazine cutouts of actresses of who they want to look like. And again, this is unattainable. It's unrealistic. These are unrealistic expectations, and it's not the patient themselves. And then doctors will also show patients a photo library of patients that they've operated on that are similar or similar enough to the actual patient that's in their office, but it's not the same as seeing themselves of what they would look like if they actually had surgery. And so all of these methods, although routinely used and are part of the doctor-patient consultation to date, are not as effective as actually talking to a patient about what they would look like if they actually had a procedure done and how that would change how they looked. And so 3D printing is really a paradigm shift in terms of the doctor-patient consultation in cosmetic surgery. Patients don't need to visualize what they're going to look like. They have a model that they can hold and rotate and view and bring home to their family and friends if they so desire about what they're going to look like. And it gives patients much more realistic expectations about what they're going to look like and how they will change if they had a particular procedure done, because it's not a model that they're looking at or someone who's similar to them. It's actually them. And with all this, providing patients 3D prints really improves the patient-doctor communication. And so just to mention, there are many doctors who are interested in incorporating 3D printing into their practice who don't have 3D camera systems. And we do have the ability to print for doctors office displays. So instead of having their books of patients that they've operated on and showing patients their best before and afters, we can print sort of a library of surgical displays just using standard 2D photographs. And every surgeon has 2D photographs that they take of their patients before surgery and after surgery as their post-operative images, and we can create a whole library or display for doctors. If they have a 3D camera system, that's great. If they don't, we're still able to convert those images for doctors to display in their office. So this is just another way that 3D printing provides value to plastic surgeons and plastic surgery patients. And so the other thing that I did want to talk about is the virtual reality consultation and how this technology, incorporating this type of technology, is really going to change the whole plastic surgery process. And so patients these days are very educated, and they come into doctors' offices with a lot of knowledge, some correct and some incorrect, of things that they've read and things that they want. And plastic surgery patients are really consumers these days. And they want to have a say in what will go on in the operating room and what their results will be. It's no longer patients coming into the office and saying things like, whatever you think is best, doctor, or I trust you, or things like that. Patients really want to feel in control and want to have a voice in terms of the whole process. And what we have is a patient portal which gives patients the voice that they really desire. Patients have the ability to upload standard 2D photographs of themselves. They have the ability to simulate what they would look like if they were to undergo particular plastic surgery procedures. Whether they upload photographs of their face, they're able to manipulate what it would look like if they had their nose done. They can upload photographs of their breasts and choose various size implants and play around with it a little bit, and then order a print that would be delivered to their door of whatever size they want. And they, in the privacy of their own home, they could look at the print and look at what their results would be, and then go to a plastic surgeon with that print and with that knowledge of what they want. And what we found is this is really going to revolutionize the plastic surgery consultation. And so in summary, providing prints to patients and doctors and incorporating the use of 3D printing in plastic surgery is going to be a real paradigm shift in the cosmetic surgery world. The use of 3D photography and simulation software will soon to be standard of care as more and more surgeons are incorporating the use of this technology into their practice. The more surgeons that incorporate the use of simulation software, the more they'll realize the value of 3D printing. Its value both in the pre-consultation, getting patients into the office, its value in the consultation, aligning patient and surgeon goals, the preoperative planning phase in terms of the software analysis and facial analysis that takes place, the use of 3D printing as an intraoperative tool, a postoperative tool, as well as the office display to show to future patients. All of these areas are 3D printing has an impact on. And patients, what we need to remember is that patients are consumers, and they want to have a voice in the process, and they want to be a part of it. And providing them this opportunity is beneficial both for the patient and the doctor, but is also going to be sort of standard of care. And patients and doctors both benefit from this technology. And, one thing to say is, I've discussed a little bit about the value of 3D printing, and based on the response, this company MirrorMe3D is less than or just about a year old. 6 months ago we initially launched, and the response has really been tremendous. And so from business outlets to medical outlets and technology outlets, people are very interested in this. Obviously from the plastic surgery community, which is where we started, or we still are, surgeons have found this very beneficial for their practice, but the consumers are very interested in it as well, because we believe that this is going to be sort of the future and is the future and will become routine practice and standard of care. Finally, I just did want to mention two really important strategic partnerships that we have. One, technology. All of our printing is done through 3D Systems. We believe they have the best quality color printers, and all of our stuff is printed through their ColorJet printers, and they've been a wonderful technology partner. And our other strategic partnership in this is Chrysalix. Various different doctors have used different types of capture systems. They're one of the companies that have really seen the value in terms of 3D printing, and they've incorporated a 3D print button into their platform, making it very easy for both patients and doctors to order 3D prints from their platform directly to us. So I just wanted to thank everyone for giving me the opportunity to talk a little bit about the use of 3D technology, particularly 3D printing in plastic surgery, and I am open to any questions.
Well, Carrie, thank you very much for taking time from your vacation here in Miami to give us this excellent presentation. Well organized, clear, great slides. Let me just, the audience has a question here, and I quote, "Do you foresee the materials used in 3D printing to reach a quality and consistency to the point that it can be used as actual implants for reconstructive surgery? Or do you think it will primarily be used for patient education and guides?"
So I do think that it will have the quality and consistency that can be used as it is for reconstructive surgery.
Right.
Prints are the ColorJet printers, the prints that we use are very realistic. You can see the last slide, they're really spot on. So I do think that they can be used similar to how it's used in reconstructive surgery. There's definitely a role in terms of patient education, but I do think it can be used in a similar manner.
Well, I'd like to comment on that. One of the things I learned once I got involved with various doctors using 3D is that it's a combination of 3D tech and material science. That's one area where there has to be advances for various types of materials to be used. And I think that may answer it if those materials used in those possible implants would be biocompatible or whatever. I have a question.
Well,
I guess you kind of go ahead.
I'm sorry.
Go ahead, Carrie, because I was going on.
I was just going to say, just in referring to the implants used for reconstructive surgery, the ones used for reconstructive surgery are sterile models. The ColorJet printers, the ones I showed here, are not sterile. So if they were to be used in the operating room and brought in as the reference, as I mentioned, someone else needs to hold it or the doctor needs to change his gloves. But there is a sterile model that we've worked on and working on that is quite similar to the implants used for reconstructive surgery that surgeons will be able to hold just like they would any of the implants used in reconstructive surgery. And I do think the combination of the sterile model plus the ColorJet printer model will really replace the traditional 2D photographs.
Okay, and you kind of answered. I had a question until you got to the end of the presentation about virtual consultations, and you mentioned in your talk how a small percentage of people that think they want plastic surgery actually come in the office, and you feel that having virtual consultations will bring a greater majority into the office, correct?
I do. I think people, millions and millions of people sit at home thinking about the what ifs if they, had surgery. What would I look like? What, all that. And I think for some reason, patients are somewhat apprehensive about going to a surgeon's office. I don't know if it's fear, time, a money issue. I'm not quite sure, but I think that if they're able to sort of manipulate themselves in what they think that their ideal outcome would be in the privacy of their own home and see
Right.
what they would look like, I think it would absolutely bring more patients into the office.
Typically, do you talk to those people, or do they just kind of contact you by email, or
So,
how does that work?
yeah, so it's not, the patient portal, they just really send us the photographs, and we send them the 3D model that they can then manipulate. So we don't
Okay.
necessarily do the virtual consultation, but it allows patients to then go to find their plastic surgeon, who they can talk about what their experience was like and what their print looks like and sort of what they want to get out of after having surgery.
Okay. The time factor, Carrie, if someone comes into the office and says, okay, I want to have my chin worked on, nose worked on, whatever, you take the mold, what kind of a time period are you talking about before the patient can come back and see? Is it fairly quick?
Yeah, so from then the time the print is ordered, typically the patient goes into the office. Let's say the patient goes to a surgeon's office who has a 3D camera system and they do a consultation, is interested in ordering a print. They send us the model or the images, and we turn around a print within a week, typically. So it also brings patients who are sort of on the fence of if they want to have surgery or not back into the office for a second consultation to review their print.
Mm-hmm. Very good. Very good, Carrie. I'd like to thank you again for taking the time, and appreciate it, and look forward to continued developments in cosmetic surgery with 3D. And
thank you very
hopefully
much.
we'll build a community of 3D in medicine. Hopefully you can participate in the future. And I'll be talking to you soon.
Fantastic.
Thank you very much.
Bye-bye.
Thank you. Bye-bye.